Eyewitness News. Also coming up,
Zipline is decommissioning 3 of its centers, Center 4, Center 5, and then Center 6.
Emergency medical supply to rural areas to be affected as Zipline shuts down 3 of its drone delivery centers over government indebtedness. And later on Eyewitness News.
You don't need the OSP. Mr. President, we are telling you, please. We are appealing to you. You don't need the OSP.
The huge demonstration in Accra demanding the removal of Kisi Jabin as special prosecutor by the president. Stay with 97.3 Citi FM for more on this and many other stories on Eyewitness News. And in business,
Chamber of Agribusiness to petition President Mahama over government's refusal to halt rice and egg imports.
the show is live across Ghana on a number of affiliate stations. We are on Premier 100.5 FM, Beach 105.5 FM, and Sky 93.5 FM. We are also on Greener 95.9 FM. We are on Orange 107.9 FM. We are on Right FM 90.1. We are also on Holy 98.5 FM. We are on Dasuma 99.1 FM. We are on Word FM 88.3. Eyewitness News is live on Mic 105.3 FM. And we are on Boogly Radio 88.6 FM. You can also follow us on YouTube and on Facebook by following Citi FM. And you can join the conversation by sending your messages on WhatsApp. It's 0549 986 996. 0549 986 996. On Twitter, now known as X, mention my handle at Umaru Sanda or at Citi973. And the world will hear what you think. This is Eyewitness News on 97.3 Citi FM. I'm Umaru Sandamod here with Ejubi Wiafiakent. And we start off with the Zipline drone delivery service. You know that company that delivers medical supplies to hard-to-reach areas in Ghana. We are told tonight that 3 of their centers are going to be shut down as a result of government indebtedness. The Zipline itself has written a letter to the Minister for Health, and this letter was dated November 24th. That should be today. So it was dated actually yesterday. So yesterday, November 24, 2025, the letter was signed by the country director of Zipline, Ghana, Daniel Kweku Meki, or Meko. And it is saying that, I'm just going to read the last but 2 paragraphs. It says, as referenced during our meeting with the Chief Director on Friday and further to our WhatsApp engagement and call with the Chief Director earlier today on Monday, we look forward to our meeting tomorrow and remain available at short notice to support any steps the Ministry may identify. Zipline remains committed to Ghana, stands ready to continue engagements in good faith. But the consequential matter is that they have shut down 3 of their centers. Dr. Nana Eyewitness, my senior anchorite and ranking member on the Health Committee, is Member of Parliament for Asokore. If you just say Asokore Mampong, he's joined us on the line. You're welcome to Eyewitness News, Doc.
Yeah, thank you so much.
So,
Mario,
I've just seen the letter Zipline has written to the Minister, but you have further information because you made a statement in the House of Parliament on this. Can you tell us more about what appears to be this standoff between the government on the one side and Zipline?
Yeah, the situation is more of a very good evening to your listeners. The situation is more of non-engagement and not payment to Zipline. When I say non-engagement, there's a series of letters from Zipline to the ministry and times that they have even written to the president. And it was to draw their attention for them to engage on its operations and its financing. But what appears to be the case that they've not been engaged. And then also they decided, having operated for about 9-10 months without any payment to them, they had to outline in phases the commissioning of their distribution centers. And so they wrote again to the ministry about their intention. And as of now, nothing has been done. They wrote again on the 21st of November, again with their intention to close down, to shut down in phases The first phase will be to close down phase centers 4, 5, 6. Centers 4, 5, 6 actually is 4 is got to do with the Western North area, Afriyie also. And that serves Western North fully, part of Western region, part of Central region, part of Ashanti, part of Bono region, part of Ahafo region. And then also Center 5 is the one in Enum that supplies blood-related products, vaccines, emergency supplies, and other medications to the Volta region fully, parts of the Eastern region, and also part of the Afram Plains. The Center 6 supplies fully the OT regions and also part of the Savannah regions, part of all of the Bono East regions, and then some part of the Volta region. So basically, that's going to happen. That is what is happening, which means that effective today, it's most likely that in the next few days there will be so much reported cases of death, more to do with the blood supplies, because all these how-to-reach areas, the farm plains, the Savannah areas, the Safi enclaves, sometimes the border towns, so difficult to have referrals to the center. Sometimes it can take several hours. And, blood are sent to them within about 10 minutes, it's there. We are losing all this opportunity. You don't see if there's a backup measure. There's a backup measure. If they will be commissioned in phases because government has set up infrastructure that is taking care of the gap, when everybody is fine. But as I speak to you, there is no arrangement. And this is really going to cost a lot of lives here.
Is it the case that government is not engaging them at all?
Yes. If government would engage them, I'm sure Zipline wouldn't have think they need to be commissioned. And the frustration from their team, because I had to write to them to get understanding. I've followed this through the past weeks, and therefore I have a firm understanding of their frustration they are going through. And it's a case that they are not being engaged. They are not being engaged. Yes. And no releases have gone to them.
Could it be the case that government does not find their service that valuable or important, for which reason government cannot be bothered?
Yes, I think that is more of a political decision. It's more of a political decision, and that's going to cost us a lot. This is another smart one, seriously speaking. We can't do everything in politics. No. Things to do with the emergency supply affect the life of people, access to health care, mothers' maternal mortality. Things like this are things that if you do politics with it, it's going to be dangerous. I mean, really, you have 175 million you owe them. And then this year, the 2025 budget, I think they made an allocation of 20 million to them, and no amount of money has been released to them. So zero. And then also, the principles of the budget, there is no mention of Zipline, unlike the other years that government had mentioned Zipline to show the demonstration of government to the people, the poor people, and the fact that they need to get emergency supplies and also blood-related products and blood to the people. This year, among all, and the two budgets we've witnessed in the year, no mention has been of blood and blood-related supplies, and it's most likely to be a political decision. That is dangerous.
So what if an argument is put forth that before Zipline we were fine, and that after Zipline we'll still be fine, and that Zipline
the size of the population is not the same.
So my question, the emphasis, that was just a foundation. My main question is, how important is Zipline in our value chain when it comes to the health sector?
Yes, as we speak now, the importance of it will show in the figures you have with regard to maternal mortalities, access to health care and essential medicines, reported cases that were related to deaths and, for that matter, issues that borders on vaccination. And so if you look at total vaccination you've achieved over the past years, the overall patterns you've been able to reach compared to the absence of Zipline, you get to see that there's been coverage of vaccination has been so excellent because it's been boosted by Zipline. We've had periods of presentations by Ghana Health Service the past 8 years, and that actually has talked about how their operations have increased the coverage of vaccines and, for that matter, immunization of children. So this is more of a backward measure. We cannot move technology to fill in the gap, to increase access, only to find ourselves like, okay, in the absence of technology, how it was, how could it have been when the world has moved on?
Okay.
It's untenable.
So the absence of Zipline may affect us in terms of supply chain. Now, would it also affect us in terms of finances? Do we stand to lose money because of the contractual relationship we had with them, or the fact that they are packing bag and baggage and moving out, that should end the cycle?
Yeah, I mean, obviously you have a contract with them. The effect of the contract is going to be there. But why would you even think about the need for you to cover? What you have to do is engage them. You are spending a lot of money on Mahama Care Trust and this depriving them any type of resources. Almost about 2.6 billion has gone into Mahama Care Trust, of which we don't know what it's going to use for, what they're going to apply for. We're talking about reducing the burden of non-communicable diseases. And we're talking about the things that cause women to die immediately. You're talking raising about 2.6 million today. We're talking about 170 million cities which can get data of Zipline for it to pay for the next 5 years or so. Why would you want to make fake decisions or to make decisions that is causing the lives of people? The marginal social cost of this is just worrying, terrible. And I don't think government would have to move in that direction. They need to retreat. And there's all this about politics and innovation by the MPP and co. And I mean, who says government is not a government or governance is not a continuous process? I think the issue to do with this is extremely political. It's been a position of the minority when the majority when they're in the minority. And we know about what they spoke about to engage them. And we emphasize the political bit and look at the marginal social benefit to the people. And let's make progress in this. This overt politicization is totally needless.
Thank you so much for speaking to us. That's Dr. Eyewitness. He is NPP Member of Parliament for Ifeduasi Sokori and Ranking Member on the Health Committee. Let's speak to Professor Titus Bayo. He is NDC MP for Lambusie and Member of the Health Committee. You're welcome to Eyewitness News, Prof.
Thank you very much, and good evening to the listeners.
Good evening to you. I just finished speaking to your ranking, and he's not happy with what appears to be government's tone-deaf attitude towards Zipline. And the consequence of Zipline shutting down 3 centers, and which would be maybe 3 of many if government continues to be stone-deaf, would be perhaps loss of lives and a lot of other consequences that we do not want. Why is government quiet and not engage in Zipline, like your colleague is saying?
All right. Thank you for the opportunity. I think the ranking actually raised this on the floor of Parliament, but I'm glad that I have this opportunity to clarify a few things. I can state on authority that the Ministry of Health, for that matter, the Minister, has been engaged in Zipline. Information to the contrary is difficult to substantiate. There is ongoing engagement between the Ministry of Health and Zipline to review their operations and to realign to ensure that there is effectiveness of what they do. I also want to put out here that the picture painted by the ranking is a bit overrated in terms of the effectiveness or efficiency of Zipline, and in terms of the impact, the consequence thereof if they decide to fold up. And I will back that with some bit of data. In terms of the effectiveness, you were saying that you can assess how effective they have been based on the vaccination. There is a review that has been done, comprehensive review of the activities of Zipline. And if you take even just oral polio vaccine, we give it in 3 doses, OPV1, OPV2, OPV3. If you look at the performance before and after Zipline, there is no significant difference. And this is statistically proven. The data